Welcome to Vale la Pena. In English, that's worth your while. I'm your host, Cynthia Ribas. This is a show where we get to do some grassroots philanthropy together. In all episodes, we'll feature nonprofit organizations engaged in inspiring projects for people, animals, and the environment. Some guests will be representatives of those organizations, and they'll share with us more about initiatives they're working on and ways we can participate. Check the show notes for opportunities to impact these humanitarian causes together. You can find this show through my website at www.rebuslegal.com and on YouTube, Facebook, Apple Podcasts, Spotify, Google Podcasts, and more. Now, please join me for Vale la Pena. Hello, I'm Cynthia Ribas, and welcome to Vale la Pena. If you're new here, we are a show committed to grassroots philanthropy. And the way we do that is we talk with guests about all kinds of inspiring projects they're up to in support of humanitarian causes for people, animals, and the environment. In this case, we have a very special guest with us today. Her name is Malene Davis, and she's founder of West Virginia Caring. So much more I can say about Malene, but let's bring her on and we'll get that going. And can you speak to the financial complications? Like when you were saying we want to have more people be able to afford this in-home hospice care as much as they wish.
So,
what percentage of that is sort of Medicare, and what are people having to finance personally? What are the stats on that?
Well, the wonderful thing about hospice care for those people who are eligible for Medicare Part A, which is the hospital part of Medicare, then the hospice care is paid for 100%. There's no deductible and no copayment. And it pays for supplies and equipment and medications related to the terminal illness. But it is still an intermittent visiting, so that we don't go in and stay, for, hours and hours at a time unless there's a crisis going on. So the family, is there by themselves with us, in the background, always a phone call away. And so they are predominantly there. And so there are times when they just need a break. And so and then there are times when there's no family. We have that in West Virginia where, maybe the kids went out of state for work. And so, you find two 90-year-olds taking care of one another. And, you really do need an outside source. But agency care can be expensive and, on the upwards of, $20 to $30 an hour. And so not everyone can afford that. So what happens is, people end up spending their life savings down to, a point when they can afford for maybe the state to pay for them to be in a nursing home. When really, the flip side of that is that if we could have spent that money to train up people to care for them, not everyone needs 24 hours a day care. They just need sometimes moments of time during the day when someone needs to come in and make sure that they're eating or they're dry or they've been up. And, I just think that would be just a wonderful way to spend, money to be able to, these people have wonderful homes they love. That's, where their sanctuary, where they've just felt comfortable their whole life. And then to be taken out, is it's hard because you just don't have someone to, we can't care for you by ourselves. So we really try to maximize our services, in those regards. When you have two 80-year-olds taking care of each other, I mean, sometimes we'll send, a nurse's aide back in the day. She goes once, but go back a second time just to make sure everyone's, clean and dry and had something to eat and safe. So, I think that we can be very creative in the way that we roll this out. And we're very, we want people to be successful and meet their goals. And if it's, to be at home. Now, we also care for people in, long-term care facilities, which was during the pandemic very hard and difficult sometimes. But, again, then we have hospice people going into the nursing home. Yes, they do have their own care, but this is dedicated, hours of time just with one person, just really, talking and caring for them. That doesn't, this person's not going to bingo, and participating in the activities at the nursing home anymore. They're really by themselves, but their brain may, and often is working just fine. It's just the physical body has just broken down, so they need a little extra help. So wherever a person calls home, because that now is their home, then we go there. But there are a lot of people, and I think there's actually been some studies done in other states. Medicare has done some demonstration projects where they've actually just kind of went into nursing homes and kind of took a roll call about who could possibly functionally be at home safely if they had some help coming in. But when you are on a fixed income and Social Security and things like that, to pay $20-$30 an hour or upwards, it's just really, people don't, just don't have those funds.
So maybe you're saying another thing that might help would be, as the word gets out about the value of the services, to perhaps the support that goes to nursing homes, some of that can get reallocated to train people to provide more in-home care.
Yes, I do. I think that there are, I think functionally we would have to look to see, to make sure people can, safely be there. Right. But I think that there are some people that, probably could remain at home if they had those resources around them. And some of the resources might be paid, but then, for us, for example, we get the church. If you went to, if you were a little girl that went to church and you're associated with the church, we, make sure that they know that, these are some things you need. And so you have neighbors coming in, and we kind of just activate all the resources that are around you kind of in a 360 way and say, okay, I'm not sure. Of course, we get their permission first to say, is it okay if we call your church and let them know that, to check on you? And, and then they might start bringing some meals over, or, call and, pick up a, loaf of bread or some milk, or, whatever you need, or just come visit. Because I think that once people are cut off from the community and from social resources and activities that they had, that there's the sadness that comes upon them. Because, it's like when my dad was at home, he had liver cancer. And, he would ask me, who did you see, uptown? Did you see anybody that I would know? And so he was very interested in, who was out and about and what they were doing. And so I think that, people, it takes up, a lot. We're spiritual beings, we're social beings, we're emotional beings, we're physical beings. And so I think this makes up the whole person. It's not just about taking medicine, but it's really about extracting all the good. And I heard someone say once, it's not how you start, but how you finish. And, you've heard that phrase before, start with the end in mind. So I think the lesson for all of us who are still working and operating is that, you do want to, be in touch with yourself and take care of yourself as best you can. And we do a lot of that coaching while we're in people's homes. So, where as people are looking at this, and health things, we have health fairs where we draw blood and to the community and organize people to come in and give as much information to folks as they can. And people say that's kind of a weird thing for hospice to be doing, but not here in West Virginia. This is really, we see ourselves as really, catalysts and pioneers, if you will, kind of trailblazers for getting, information out to folks so that they can make great decisions. And we, oftentimes will say, well, come in and talk with us. I don't think hospice is what you need, but you need something. Let's figure that out. So we use our social workers in that regard all the time.
And then you said that West Virginia Caring is celebrating 40 years now. So, way back at the beginning, how did you tell us about how you had the vision and how you came to form and found this organization?
So it's a great story. There were two physicians and a couple nurses who were getting together in 1983 and saying, there's this concept called hospice. It came across from England. And, I think that we could really use it in our community. It was in one county. And so they would meet, they would convene, and they would bring envelopes and postage stamps and write letters and kind of just talk about, with people, try to get some funding going because it wasn't, paid for by Medicare here where we were at that point. It was another, in West Virginia, you could have, but we weren't at that point. And so they finally, worked at that for a while, and then they, wanted to hire an executive director. And so I was an RN with a business degree because I was young enough to think that I wanted to work in a hospital and that every hospital should be run by a nurse because it was, that was the only best way for it to work. And, what do you know at 24? But the, so I went and applied for this. Responded to this classified ad that I swear was as big as a sugar packet. It was like, it was as big as a Splenda packet. And it said, healthcare preferred. And I really did not know. I just, graduated, been out like maybe 2 or 3 years, that we didn't talk about hospice care. I had no idea what that was. But so anyway, I applied, and it's so funny. I tell the story that my mom and dad were kind of getting anxious because I had a business degree, and they're like, what are you going to do with this exactly? And so my mom was a United Methodist. She was praying about it with her group, and the pastor came up and, told me that they were praying for me for employment. And when I went for the interview in MBA school, they said, be any color, but don't be beige. And so, be strong or, one way or the other, but don't be beige. And so when I went in for the interview, what do you think? The color of the carpet and the walls and everything were beige. So it was like a Forrest Gump moment where you just want to run. But, my dad said, why don't you try it for 6 months? Then you'll have some experience. So I thought, okay, I will do that. And here I am 40 years later. But, it's one of those things where and it was just so fulfilling to me as a nurse to go and, go into these communities and just talk to people and educate them. And then like the light bulbs go off. I said, I've been to a lot of senior centers where they're serving Salisbury steak and mashed potatoes and they're like really ready to go to sleep. But to tell them that, there's this, when it's your time and you need this, then it's a wonderful benefit that's completely paid for. You won't get a bill from hospice for any of it that's related to your, what's wrong with you, But, and then people, they have their traditional insurance and Medicare in the event for other things unrelated. But, it's just really this eye opening, and it's still occurring. It really is, 40 years later, where people are like, oh, I didn't know that's what it was. I didn't know that's what, what happened. So we get out and we do a lot of speaking engagements. We, really interact with faith-based communities and civic groups and really just kind of talk about it and make it not such a scary thing for folks. No one escapes, right? Not, I haven't heard of anyone yet. So I think that, we will all, pass that way at some point, and to be prepared and really have it thought out, about, what it is you want to do. But it's interesting, during the pandemic, we had a lot of people, coming into West Virginia for a little, retreat from so the Floridians were coming up during the winter, and, it was interesting, just working with families, and, they wanted to know, should we wear our mask or not wear our mask? And how should we, what are we, what's the right thing? And so your true nursing really came out, because it wasn't just about end of life care, but it was about healthy families and talking to one another and just really communicating and getting down to what's important. I've been with hundreds of people at their time of death, and not one says, I wish I would have had a nicer car or a bigger house. It's all about relationships and And I wish I would have got to tell my brother I'm sorry and, to forgive me. And why did we fight for so long? That was crazy, and so that's the wonderful thing I think about hospice is that that the end is coming. So you can make, take steps to correct some things that, probably went on for too long and was really, when you add it all up, it was, really not worth it, anger and stored up things that, we all are sorry for at some point.
You mentioned doing the work during the pandemic, and I can only imagine how difficult that was, because even though people have a certain comfort level with masks, particularly in the healthcare arena, like even before the pandemic, it's not that uncommon that medical professionals might have a mask on. But all that social distancing, right? People were very concerned about who and how many different people they wanted in their home. So I bet that added a real level of complication.
Yeah, it was, we really worked very hard to navigate that. And there were some times we were meeting through a screened window. Of course, it, really, like everywhere, it was like March of 2020. So in West Virginia, it's very cold, but, we might, if it wasn't necessary to actually, take a blood pressure or do that, we might meet through a screen window and just said, how are you feeling? Are you having pain? Do we need to change up the, medication, or, how talk to us? And we actually even did that. They once some of our nurses made signs for people at the nursing home. So we'd be outside of the nursing home and say, we miss you and how are you doing? They would roll the patient up to the window so they could, see, and then we would even, take pizzas and baskets of food to the nursing homes so that, the staff there, because they weren't getting the extra help that they were accustomed to with hospice not going in, because they were just so afraid that things would, pass from one person to the next. And then you would have, a lot of sick people and who might not make it actually, in their midst. So yeah, we navigated a lot. I mean, in the beginning, there was not enough masks and things. So we had sewing machines here in the Eleanor Roosevelt ballroom and people making masks. And, it was, yeah, I mean, it was really, you thought, here we are in, this day and age, and this is really how we're having to do that. But, you couldn't get hand sanitizer, and, people were accustomed to all the things that were shortage, toilet paper and all those things. But, even here, it just took a long time to get the things that you needed. But that's really when you really appreciate the health departments and people, when they got things, they would call us and say, we just got some masks in if you want to have someone swing by, and so you saw communities really pitching in and really caring for, one another as we were all trying to figure out what to do next. So,
well, and you're dealing with vulnerable populations, so it must have been so tough. I'm really so grateful that you're not there, right? You got through it and it's not that way anymore. So I wanted to ask you, there's a term that I hear that I recently learned in your industry, that's deaths of despair. So what are we talking about there?
So I think, in our industry, of course, I think people being ill prepared and just not ready, not having enough time to just, prepare with the diagnosis, and just, having pain out of control. I think that people that don't have hospice care, that there's a lot of needless suffering that happens that could have been avoided had they really been, receive the care that's really available in every part of the United States. So I think there's that. I think that deaths of despair have also been attributed to, people who are just hopeless, who just really, have no hope. They, just don't feel the worth of life, and, really have gone down a road with, abuse of, drugs and things like that, just because they just don't see any hope in this life. And, there are groups popping up all over the country to really, mostly, related to the faith-based communities, really talking about, we've thrown a lot of money at that and trying to, correct that. But really, it comes back to community and relationships and identifying people like that, and not just, giving them things, or, you pass by someplace and here's a poor guy that's asking for money. It's not just giving money away, but it's really retraining people, how to, approach life, and just kind of coaching them through that. It's like that, what's that adage, you can give a man a fish, but, if you teach him to fish, then he will, be able to make it. And so I think that for us, I think deaths of despair are people just that are ill prepared, that just aren't ready for that. And just, people haven't talked about it. Often I'll say the people in the kitchen are not talking to the patient in the living room. They're talking with each other, but not, separately, but not talking together. And they all know what's going on. But I think that we're just not good at talking about it. So one idea that I came up with years ago, as I said, at Thanksgiving dinner, you're all around the table, and you could start with yourself and say, I just want you all to know that if it's my time, or if I was in a car accident, or, had a heart attack, I want, this person to make decisions for me. I don't want you all to worry about that, and this is what I want. And I've got it laid out. And so then, you go around the table because you started, and finally you get to mom, who says, well, me too. I wouldn't want, this or that or the other thing. And so then, it's more comfortable that way than when you wait to the very end and things are at a crisis point and you're like, oh my goodness, we didn't prepare for that. And so I think that, I think deaths of despair are really when, families are just really grappling with what to do, and how to approach it, and how do you get people's pain under control in a safe way, in a home, that might have kids there, and with all the things, societal things that are happening with having, medicines and things, around, and temptation about those things. So I think that, we're very careful about how we deliver, all of this in someone's home, and go very often so that we can monitor things as well. But mostly it's about monitoring for, make sure that people are not experiencing pain. That's the charter of every hospice in America, is that we are managing, people's comfort levels, pain, and all the other side effects that come sometimes with medicine, but just come with disease, not feeling like you can eat, you don't have an appetite. And so, our goal is to help people to, live and enhance their lives as much, even though we can't take away what's ailing them. We just feel like, if someone wants to go fishing or in the car with their loved one, or goes to my mom, her goal now, and it has been for like 10 years, is to see her one of her grandsons graduate from high school. So he's going to graduate in June. And so, that's her goal. And so we want to get her to the goal line. We really want that to happen for her. And that's, it's important to her. It's important to us. And so you want people that are on your side and that are rooting for you and that are going to go the extra mile to get you there. So I love that part about the job.
It's kind of like make a wish for elder people.
That's right. That's right. Yeah.
Among other things. Well, Malene, we are so grateful for all the work you do in the world, really, all that community building and all that care, and that you've been at it for so long, and that you had the vision to create West Virginia Caring. Really appreciate the work you do, and so grateful for your time today with us. Is there anything else you wanted to say for our listeners here before we close?
Well, I would just say, don't be afraid to ask questions, and to, call a hospice just to find out, ahead of time, about just, how does this all work? And then hospices really do need support. And I couldn't be more grateful and more proud of people like you, Cynthia, that are, helping us with that, and just kind of giving us a platform to talk about something that's, it's not wonderful to talk about. We don't, just sit around Sunday dinner talking about it. But at the same time, I think that it's families that do and kind of approach it and even tippy toe into it. are ones that really have beautiful time together as a family and just rally around each other. So, but thank you so much for this opportunity, and I just think it's a wonderful thing that you're doing, and you do a great job at it.
So grateful to you. And okay, and for the listeners, we're going to be putting in the show notes the direct links to West Virginia Caring, so you can participate directly with them through donations or otherwise. And again, Malene, thank you so very much. Talking with you has definitely been worth our while.
Thank you.
Thank you for tuning in to Vale la Pena. Please join us in making an impact together for people, animals, and the environment. Details in the show notes. You can find this show through my website at www.ribaslegal.com and on YouTube, Facebook, Apple Podcasts, Spotify, Google Podcasts, and more. I'm your host, Cynthia Ribas, and I welcome and thank you for your feedback, comments, questions, and sharing this show with others. Thank you for tuning in to Vale la Pena. Please join us in making an impact together for people, animals, and the environment. Details in the show notes. You can find this show through my website at www.ribaslegal.com and on YouTube, Facebook, Apple Podcasts, Spotify, Google Podcasts, and more. I'm your host, Cynthia Ribas, and I welcome and thank you for your feedback, comments, questions, and sharing this show with others.